Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Well, hello, everybody. This is Dr. Kurt Woeller, and welcome to the podcast. So in the past, we've talked about autism, biomedical interventions, some of the issues in autism. So we've mentioned things like B12, dietary intervention, fungal issues, digestive system problems. And in this particular conversation, we're going to focus on some of that, but we're also going to get into what's called genomic testing. And this is an important area because it's a science that has emerged and evolved over the past number of years, where if you go back 20, 25 years ago, when I first started working in the autism community doing biomedical intervention, this kind of information wasn't available back then. So I'm joined by Beth Sutton. Beth is a nurse practitioner who has a unique story with regards to her son. And she also, in practice, focuses on autism. She also focuses with individuals with Lyme disease, PANS, PANDAS, mold, mycotoxins. So this is going to be a very interesting, important discussion. So Beth, welcome to the program.
Thank you so much, Dr. Woeller. Thank you for having me. This is great.
So give the audience a little bit of an overview of your education training, and then we'll get into the main point of this discussion or this interview.
Sure. I knew from a very young age that I wanted to be in medicine. So when I got to college, I did go to Boston College. I entered as pre-med, but switched probably in my sophomore year because I felt like I didn't know if I could pay for med school, and I really didn't know how that would work with me wanting to start a family. So I had a mentor actually that was a nurse practitioner. She was my primary care provider. That was actually pretty unique going back that many years ago. So she was my mentor, and I said, you know what? I just want to be like her. I'm going to switch into the nursing school. So that's what I did. So I finished Boston College School of Nursing, got great experience there. Worked for about 5 years. I would say I specialized in medical intensive care at that time. Okay. And then I got moved out to California, and Luke was 5 months old. So he's my oldest, and he's my child now with autism. I had intended to go back to grad school, but he did develop autism, so those plans sort of changed. I decided I was just going to stay home, and that's where I actually got most of my education in integrative medicine was, taking care of him. I started when he was 2 years old, so I not only, I was in the trenches, and then when I was 40 and Luke really was doing much better, I decided to finally fulfill that dream I had and went back to school. And I went to Sacred Heart University, where I got my master's in the science of nursing. And then now I'm a nurse practitioner and licensed. And since that time, I just spend a lot of my time working in my practice, but also constant education. I'm at MAPS conferences. I'm trying to complete that mentorship. I am trying to complete the ILADS mentorship. And so I spend a lot of my time doing all of that extra education. So there's a lot to know.
You're extremely busy, like all of us, right? This is a type of medical approach that requires constant education. Hey, before we start, and actually before we started this interview, we talked about nurse practitioner, and I know one of your designations is advanced practice nurse, or what is, I'm just curious, in the designation that you have, the APRN, what's happening in the field of nurse practitioners with respect to some of the designations?
Oh yeah, no, that's a super good question. So a lot of nurses can have their master's in nursing, but not necessarily be advanced practice registered nurse. And that is designated by the state to be advanced practice. So I have to also hold an RN license.
Okay.
And I have an advanced practice I'm also an advanced practice registered nurse.
Okay.
So, but there are different types of advanced practice registered nurses. So there's family nurse practitioners, there's acute care nurse practitioners, and also people know midwives. They are actually advanced practice registered nurses. All of us have to have our masters, and all of us have to have an RN license as well. So and then
Yeah, I wasn't aware of that every person had to go through a master's program, which makes sense, right, for that extra schooling for sure. So let's talk about your son, because clearly you get a diagnosis of autism, you're not expecting it, and that turns your world upside down. Now for you, diving into this world of biomedical intervention, let me just kind of set the stage what that means, right? So biomedical intervention, another name for it would be integrative medicine for autism. And this is really the understanding that for the vast majority, if not all, of individuals with an autism spectrum disorder, special needs diagnosis, what we look at as practitioners isn't just the label they have and just pinning it on some type of neurodevelopmental problem. It's looking at some of the underlying medical biological imbalances, biochemical imbalances that can be a contributing or causative factor to some of the problems, which would be gut issues, food sensitivity problems, other biochemical imbalances, immune system problems, whatever it is. And so we're not just focused on, it's a neurodevelopmental problem, there's nothing we can do. This is a medical condition, and we have to look at things from a medical standpoint. So give us what happened in your life and with regards to your son, and where did things go?
So the MMR vaccine for Luke was basically the straw that broke the camel's back. But I think that there was plenty of things that set him up for that. So he was born out the gates with gut dysfunction. I remember him carrying him home as a newborn and him passing gas that was so foul smelling that I was like, this can't be good. He had at 2 weeks, he developed terrible reflux. What do you think they did? They put him on Pepcid. We switched him to solids. He was still breastfed at that time, had horrible constipation. Then once we went to whole milk, right, then just diarrhea. Of course, not alarming to the pediatrician at all, none of this. But I think that gut dysfunction, and I'm not really sure why he was born with it. I think that this is obviously just speculation, but I did have a lot of mercury in my mouth. I think that might have done it. I had might have contributed to some of the gut issues that he had. I'm sure my microbiome was off. So he was born like out the gates. He had this gut dysfunction, and I think that really set up his immune system. And then, like we'll talk about later, he had some of these SNPs that I also think made him prone to having a big inflammation response to the vaccines. So I do remember at 15 months, he had a set of vaccines. A lot of things changed. He started becoming had a lot of sensory dysregulation. I didn't know that's what it was, just a lot of tantrums, but still very engaged, very connected, language off the charts. Then I delayed his MMR. I don't even know why, but to me, it just wasn't feeling right. That time, I did not have any concerns with vaccines. And then he had the MMR at 19 and a half months, developed what a neurologist called mild encephalitis post-MMR. And he recovered from that, but then every day we lost more.
So they actually documented that. That was actually stated. Wow. Okay.
Yes, that was stated. So every day we lost more. It's hard to talk about, but he became more distant. Spontaneous speech sort of disappeared. By the end of the regression, he could almost barely walk.
Oh my gosh.
That's how bad it was. Yeah.
The mild encephalitis, that's like saying mild myocarditis.
Yeah. Yes.
They throw these labels out there. Oh, it's mild. People go, it's like, that just must mean it's like a mild cold. No, these are serious effects. How long would you say in total, right? There were obviously some things happening from a health perspective prior, but from that series of shots, the MMR, what was the total time frame, do you feel, of that regression? Was it a couple months? What was that period of time? would you say?
He was fully diagnosed as severe autism at the age of 2.
Okay.
So 19 and a half months between those two.
Okay.
But I would say the worst of it was the 6 to 8 weeks following the MMR.
Okay. And that is a pattern, Beth, that I've seen for decades now. That story you tell, that tragic story you tell with your son is, I've heard that story repeated from parents all over the world. Sometimes quicker, sometimes a little longer, but it's generally the same. So did his gut issues get worse, by the way?
What happened was I switched him to a gluten-free, casein-free diet. I started researching the DAN protocol. Actually, my mother did. I was also postpartum with my daughter. So my mother started doing research. I was not in the mindset. And she's like, started coming, it was the DAN docs back then. And she's like, let's put him on a gluten-free, casein-free diet. And actually he had almost, really good improvement when we switched him, but he went from diarrhea to then he was just chronically constipated. So I was happy to be done with the diarrhea. So yes, he had chronic gut issues even after that, mostly constipation and bloating. So
for those who are not familiar, DAN is Defeat Autism Now. That was an organization that was developed many years ago. One of the founders was Dr. Bernard Rimland, who started the Autism Research Institute in San Diego. And there were many other doctors at that time. Most of them had children themselves. In fact, my first introduction to the world of autism was by going to a DAN conference in 1998, I think it was, in San Diego. At that time, I had no idea what autism was. My only knowledge of autism was I saw the movie Rain Man in college. And I was working at a practice, and we got a notification, like a flyer in the mail. And the guy I was practicing with came to me, he goes, hey, you want to go to this conference, this DAN conference? It was at the San Diego Convention Center. I'm like, sure. I mean, I didn't know what to expect. I was completely blown away, totally overwhelmed. And that was my first introduction to this whole biomedical approach. So gluten casein-free diet, right? That's a foundational intervention that's been around for many, many years. So you're starting to do some early biomedical intervention. And I'm assuming, and let me know if I'm wrong, right? You're starting with some gluten casein-free diet. And then usually at that time, it was also, let's start some supplements, maybe some B6 and some magnesium. And then, we've got maybe some issues going on in the gut. So maybe a stool test or perhaps an organic acid test. How did that early phase for you go?
So for me, that early phase was really rough because I had a very sensitive child. So he seemed to overreact to almost everything we did. So I focused mostly on a little bit of supplementation, but mostly diet. I went from gluten-free, casein-free, and then we kind of went into SCD, and then we went into the GAPS diet because he was actually quite sensitive, which there's lots of kids like that, right?
Yeah. Yep.
But I'm sure you've experienced that. So I actually did my first genomics testing. It was one of the first tests I did. That was Amy Yasko. So credit Amy Yasko. I mean, what was the genome finished? It was mapped in 2000. I think they had the early report in 2000, and Amy Yasko had a test that was 2006. Mm-hmm. So I did my first genomics test then. And that sort of uncovered things like the MTHFR. He had one copy of 677T, one copy of A1298C. But that information, he also had the CBS mutation, which was dreaded, I think, at that time. But that information, he didn't, at that time, I think we were trying to micromanage these SNPs. We really didn't know their significance, and we were trying to micromanage them with all these different supplements, and that was something like Luke really couldn't handle.
Okay.
Fast forward to...
I'm sorry, was there any major fungal issues or
yes.
bacterial issues that he had?
Yes, he did have a lot of fungal and bacterial issues, and I think that I really wish that there were some things that I stuck with, like looking back, But again, he was such a reactive kid that we would start stuff and it would lead to him being up all night and screaming. And a lot of times I would just shy away and I'm like, okay, I'm just comfortable with doing a lot of dietary modification because that didn't really rock the boat too much.
Right.
If that makes sense.
What about methyl B12?
Yes, we did. I did that. That was pretty early too. And that actually didn't go as well. But I think that if I had a little better guidance on what to expect, I might have stuck with it. But I did introduce it later. So we'll get to that.
It's interesting when you actually look at, so I developed something years ago, at least the way I approached it, called the 4-pillar approach. And this was understanding the importance of diet. So gluten, casein free, specific carbohydrate gaps, as you mentioned. So somewhere in there is just to continually work on diet. And then you have your foundational supplements, because most of these kids have very either poor diets, not because it's intentional from the parents, is they're selective in what they will and will not eat, right, or they have poor gut issues. So they're often nutrient deficient. So those foundational supplements help to fill in the gaps nutritionally. And then, of course, the gut problems. And that's different for everybody. So you're working on bacterial issues, microbiome issues, fungal issues. And then there's the methylation component. And years ago, it was very much emphasized or focused on methyl B12, particularly the methyl B12 subcutaneous injections. And just sometimes working on those fundamental areas was hugely effective. And not in everybody, but by and large, good 75 to 80% of the kids would respond really well. And what's interesting about the methyl B12, and I know Luke, as you mentioned, was very sensitive. One of the things I discovered years ago was that some of the compounds produced by fungus, particularly Candida, will actually interfere with the methylation cycle. And so there were situations I'd sit there and go, well, this is a kid that should really respond to the methyl B12, but they're not. They're just not responding, or they're having a negative reaction, for example. And it wasn't until you actually worked on the underlying Candida issues more that all of a sudden the methylation support would work better. And it had to do, at least in part, there may be other things I'm not aware of, Beth, but I do know that a particular compound that gets produced by yeast metabolism called acetaldehyde actually inhibits the methionine synthase enzyme, which is a critical component of the methylation cycle. So let's talk about genomic testing, because I know this is a major area of focus for you, that you have worked with many kids. I mean, as you mentioned, you started with Dr. Yaskow many years ago. I certainly credit her as well. I went to one of her conferences and was blown away at the level of information. Yeah. So let's talk about that. What is genomic testing, and why is it important, and why should parents and practitioners who are listening to this podcast really consider this approach?
So genomic testing is different than than doing like a full gene analysis. So these are just looking specifically at single nucleotide polymorphisms. So these are small variations in the DNA sequence. And as you know, Sharon Houseman-Cohen says these are not pathogenic, but can actually make a big difference in a person's health outcomes, especially if there's certain environmental pressures. So I brought up the original genomic test that we did with Amy Yaskow, because when it was, and that I didn't really find all that much use in it, that now fast forward probably 16 or 15, 14 years later, so when it was reintroduced to me through Intellex DNA by a colleague, Josie Nelson, she works with Documenting Hope. She said, Beth, you really need to check out this Intellex DNA. And at first I was like, no, been there, done that, right?
Right.
Really, it wasn't all that helpful. And she's like, no, you really need to look at this again, and the way that they do it. So I listened to, I think it was a podcast by Sharon Houseman-Cohen, and I was super impressed. And I was like, okay, I need to revisit this. Signed up as a practitioner, because now I'm a practitioner, and started the training. And then who do you think the first person I'm going to run my test on is? My son, of course. So, and the way that Intellex DNA, I feel like, has a different approach. I mean, the way that they've built this platform, and also the way that they approach genomics is that they really try to focus on what makes a patient unique in the population. What about Luke's genomics? What about Luke's genomics make him different and more unique? And what could be contributing to his overall health at this point? So when I ran his panel, they have something called a hotspot summary. And that is basically that. It's what makes a person unique. And Luke had, a TNF alpha SNP. He had 2 copies of IL-1B, which I see in almost every kid that I run the panel on with autism. I don't know about you. He had 2 copies of a VDR. Now, Amy Yasko was running the vitamin D receptor genes, but Intellex DNA really helped me understand the importance of the VDR.
And by the way, those first 2 SNPs you're mentioning, those are linked to the immune system. So those are pro-inflammatory immune chemicals or cytokines. So it shows you that even some of the past studies that were done many years ago in autism, these kids are set up, even genetically, right? Or, to at least lean in the direction or be pushed in the direction of pro-inflammatory reactions. It just needs a trigger or multiple triggers, for example. So you can always question what those triggers are, but the underlying genetic pattern is there for many of them. So go ahead.
Yes. So, maybe that combination of that TNF alpha SNP and those IL-1B SNPs made him more prone to an overreaction to a vaccination or any virus that he got. And then I didn't understand at that time also the importance of the vitamin D receptor gene and the microbiome. And I think someone that's doing the best work of that is Heather Way down at the Taga Center. Are you familiar with Dr. Heather
right?
Way? Yes, in Australia.
Yeah, I saw one of her presentations. It was very good.
Yes, and so she really works on upregulating those vitamin D receptors to get the gut working, and then she brings in GC-MAF, and she's had older kids start speaking just by doing stuff like that.
What do you? I'm going to ask you a mechanism question, which I said I wouldn't do. Do you know what the relationship is between the microbiome and the VDR, the vitamin D receptor? It's even in general terms.
It's not entirely, so
okay.
I'm sorry.
Okay. No worries.
I actually don't.
It makes me wonder because one of the things that vitamin D is involved in, immune function, et cetera. I'd like to learn more about the relationship of vitamin D to the microbiome too. So that's an interesting thing to consider. Because one of the things about vitamin D2 is it has an important role in serotonin production in that whole tryptophan serotonin pathway. But the vitamin D regulates certain enzymes that are highly prevalent in the gut and highly prevalent in the brain and nervous system. And you need vitamin D in order to actually activate these enzymes, the tryptophan hydroxylase specifically. So I was just curious. I'm wondering if that maybe is what's happening. I don't know. So we'll look it up. So
yeah,
we'll
look it up.
Yeah, there you go. We'll look it up.
So he also had the mannose binding lectin gene. So he was also prone, and I haven't really seen a kid with PANDAS not have that gene. So that is the researched PANDAS gene, the MLB2.
Oh, that's interesting. Okay.
Yes. On that PANDAS pathway, I think that's pretty much the only one there. So he also had that. So I think these were sort of foundational issues and these are genes, the way that they do it in Intellex DNA, all the genes that they run are actionable. So, you can do things to sort of intervene. So if he has 2 copies of IL-1B, when I noticed that, I said, oh, and one of the biggest interventions for that are pro-resolving mediators, so SPMs.
Okay.
So I actually, to this day, cannot take him off them. I started them all of his vocal tics go away when he is on pro-resolving mediators. So,
wow.
Am I absolutely sure that has to do with IL-1B? I'm not absolutely sure, but that is sort of that has been really foundational. That has brought about a major change for him. Also, he did have MUT-C, which is a B12 gene, but in particular has to do with the mitochondria. So I gave up so quickly on those B12 shots, and then I revisited them actually, because I was like, well, I think he would benefit, and so I've introduced them again. And he's doing actually quite well. And it's helped so much with his strength and mitochondrial function just by adding the methyl B12.
Interesting. Did you see any changes in like eye contact or awareness or just focusing abilities, which often happens with B12 too?
Yes, absolutely. He never leaves my side in the kitchen. He helps me cook, whereas before he would just sort of wander and continue to pace. So I just also want to say, like, even in an older child, if you can address these foundations, and really genomics is one of the best ways to address some of these foundational issues, they can make big improvements that really add to the quality of life. So.
Yeah, I think what's happening, Beth, is that in many kids is that there's so many interfering factors on the underlying genetics. Because you mentioned up front, right? The genomic testing isn't looking for things that are going to cause a disease per se. It's not looking at like a mitochondrial disease, but they're looking at things that can affect function. And so there can be intrinsic, right? There's intrinsic SNP, the single nucleotide polymorphism. So there's a switch of a nucleotide, but that's enough to just change the coding, and if you will, of a protein, but that can affect function. But then there's the epigenetic factors, right? The things that sort of layer on top. And that could be environmental chemicals, that could be mold mycotoxins, that could be other infections, that could be toxic food. And you start piling this on top of it, and that just sort of pushes the system towards dysfunction. And I've often thought, the reality is that I think sometimes with those really sensitive kids like Luke, is that there's just so much stuff that maybe is sort of, I don't know, clogging the system. Probably not a best way of describing it, but where something like the methyl B12, at least on paper, should work, and even maybe early on, if you go back 15 years ago and look at if you had the genetics then, you go, well, yeah, it should work. But then you do it, and it doesn't. But it's not that it couldn't. It's just that there's so many other things in the way, interfering. So that's really interesting.
Totally agree.
And by the way, what you described with the Intellex DNA report is something that I appreciate about it as well. The hotspot summary is great. And one of the things on the hotspot summary, and I can't remember the percentage, but there's something about is the prevalence that is, and can you talk about that real quickly? What that hotspot report is? Is it 22% or I don't remember myself.
I believe it's just under 20%.
Okay.
So prevalence 20 and under.
And the significance of that would be
that basically means you're that's what makes your patient a little more unique in the population. So only 20%. So for instance, I think with MLB2, now I could be, don't quote me here, but I believe that one copy of that with a mannose binding lectin, only 24% of the population have one copy. So that's pretty significant, right? Like 76% don't have that gene.
Right.
And they have wild type. So
you mentioned prior to starting this, we were talking about themes. Right.
Yes.
And that this is something you see in practice in how you sort of look at kids or other individuals you're working with from a genomic standpoint. They tend to have, some of them anyway, tend to have unique themes. Can you explain that a little bit more?
Yeah. So now when I run the genomics panel, when I run Intellex DNA, I do find specifically with the kids on the spectrum that I have kids that have a lot of oxidative stress genes, or kids that seem to be overloaded on the glutathione genes, or I had one kid that the whole inflammation pathway, Intellex sort of organizes everything according to pathways. So all the inflammation genes are under what we call a pathway. So I had one kid who had 2 copies of IL-1B, 2 copies of IL-1A, 2 copies of IL-6, 2 copies of TNF-alpha. So it seems, and that's where I'm saying, like, foundationally, sometimes I just feel like, okay, this kid has so many oxidative stress genes. Let's just work on that just a little bit. This kid has a lot of glutathione issues. Let's work on detox. And, that might cause me to run more testing, like definitely run mycotoxins panel on them and look for actual toxins that we can detox. But I do find that, with the exception of Luke, a lot of the kids ended up having a lot of themes. A lot of kids have a lot of B12 and homocysteine methylation. Maybe that's like their theme. So I found that pretty interesting. And that might just be unique to my practice. But I seem to see that on a fairly regular basis.
Well, I see that too. So,
okay. Oh, good. Okay.
It's kind of, well, I'd say it's unique to this, patient population or individuals, but, we're not running these tests, although it would be nice, on many other types of patient populations, at least in my practice, it's getting more focused with the special needs individuals. So when you look back as a practitioner with Luke, how pivotal, how important is the genomic testing, to you at this point in clinical practice? And what would a parent expect to find? How would it change, perhaps, approaches? This information goes out to practitioners as well, so they can learn from this too.
Yes, I always tell my parents that I don't want to miss these foundational things. We are still going to do all the other stuff. We're still going to work on the gut. We're still going to work on diet. We're still going to probably look at mold. Probably going to look at heavy metals and others, and immune system and folate receptor antibodies. Still going to do all of that, but I don't want to miss these fundamental pieces. If the kid has a lot of oxidative stress genes, I want to make sure that's in the program from the beginning. So we want to be supporting that. If they have a lot of inflammation genes, if they have that MLB2, I want to make sure some of those foundational interventions are there. So, and to build on, because a lot of times you could be missing a pretty big piece. And I think vitamin D receptor is a good one too. Like, we want to make sure we can test the vitamin D levels till the cows come home, but they might not be making any use of it.
Right.
If we haven't upregulated the VDRs. So I actually have a friend here who's run, she has one kid had really severe PANS who's fine now. And another kid actually who just started having some signs of PANS. But I told her that I was doing this podcast today, and she's like, that's my favorite. Now, I feel like the parents that have done functional med or integrative med or whatever, like, appreciate it more. But she's like, that's my favorite test, because we found out that one of her sons had, which we were trying everything with him, he ended up having the Schenck gene. And so that was a big missing piece for him. Like, taking out kids with Schenck too can't have N-acetylcysteine. It could actually make things worse. We use so much NAC, right? Yep. That's something you really actually want to get right in the beginning. You want to be giving those kids high doses of zinc, and you don't really want to be using N-acetylcysteine. So that's kind of how I go about it.
And you think about that, I don't know how long that information has been known, and maybe through Intel XDNA and what they've discovered, but you go back 10, 15 years ago, I'm assuming that piece of information, let's say it either wasn't known or there was little known about it. I'm assuming, because these are some of the things that I've learned as time goes on. The more you work in this area and the more you keep digging and searching and educating, this is why we go to conferences. This is why we go to MAPS. This is why we go to these. I'm constantly studying just like you, because it requires us to constantly keep ahead of the information and try to organize it all. So you answered my question. I was going to ask you, are there examples of, you're moving along with a patient and you're making progress, but things just aren't moving, or maybe there's problems still, and then you do a test and you're like, oh my gosh, they got this, and that becomes another pivotal piece for them. By the way, I'm curious, with Luke, you mentioned the mitochondrial B12. Would you consider that to be a pivot point for him? Like, you didn't know it was there, you do the genetic testing, all of a sudden you find that, and you realize, hey, let's reintroduce B12, and all of a sudden it sounds like that was the case with you. It starts working.
Yes.
Well. Yeah.
It was working on IL-1B, TNF-alpha. I kind of did, and this is what I do with my patients. We'll pick four or five, what I think are foundational things. And we'll start there, and that's laying the groundwork. So I worked on MUT-C, I worked on IL-1B, I worked on TNF-alpha. I also started, even though he didn't test positive on the FRAT test, which is the folate receptor antibody test for anybody out there. He did have the FOLR1 gene. So this helps mediate the transport of folate into cells. And so even with normal serum folate and even with no antibodies, there still can be an issue of transport. So I started high dose folinic. I hadn't done that. And so I have, Luke is way more regulated, way more engaged. Like I said, I think I mentioned this before to you, that he's the only one in his group that can work every day. He gets along with everybody. He's just a very regulated child. Is he recovered? No, we're on our way still, I'd like to say, but this has really been pivotal for us.
And I'm assuming it's been pivotal for many other patients in your practice. Do you tend to do the genomic testing or attempt to do it on all people that you see?
I would love to do it on everybody I see, but most people, it's on the higher end. It's not the highest. It's actually not the most expensive test, but it's kind of up there. So I'd always advise. I say we will actually save money in the end by doing this test, and it's a one-time test. And I think what people also don't realize about Intelix is that that's like a living database. It's a living tool. It's constantly changing. They have a whole research team dedicated to, updating the information, which is awesome, right?
Yeah, that is awesome.
So I had a patient, a kid on the spectrum, a little older, just to give another example. Parents had done a lot of biomed. And so I was like, let's do the Intelix DNA, and they were all for it. And he ended up having, like I told you, my themes. He had several of the GABRB3. I'm not going to. That's like the GABA, so low GABA signaling. Let's just say that.
Right. Gotcha.
One of the interventions that is studied for those genes is bumetanide. And so those are genes where that's a really good candidate for a bumetanide trial. And they had introducing bumetanide, that kid was more fluent. He could express himself easier. His anxiety came way down. And that was like one of two or three things that we did. And that made a big difference.
One of the things, and that's been my experience too, is when you can do this kind of testing, is it reveals things at a much deeper level. And like you say, you pick up on unique things that you wouldn't know unless you tested for it. I want to segue real quickly, because I know that you work with Lyme, PANDAS, mold, mycotoxins, and the reality is we could do an interview on any one of those topics, right? You could just pick Lyme and talk about that for an hour, talk about mold, mycotoxins. I had a very interesting conversation with a practitioner who's a specialist in PANDAS. But one of the things I want to ask you is, I know you work with special needs individuals, autistic individuals. Are you working with maybe adults or maybe kids who aren't on the spectrum who have Lyme, or maybe who have mold mycotoxin exposure? Okay, so it's not everybody you're seeing is on the spectrum. There's, that's a big part of it, but you're seeing others.
Right.
In those individuals, let's just say the Lyme person who's not autistic, are you attempting to do genomic testing on them? Would that be approach ideally? Yes,
I would. I quote unquote pitch it to all of my patients because I think everybody could benefit from it, especially in the very toxic environment we are living in now. I really want to see people's detox genes, like really want to see them.
Right. Right. And so do you, with let's say just Lyme, and that's a whole, we're not going to go into that discussion. I'm just curious though, in some of the panels, or maybe there's one example, is there something within the Lyme community that you've picked up on some of the tests that is sort of like the autistic kids? You go, oh my gosh, there's this B12 or there's this mitochondrial issue. Are there a few examples where you've done genomic testing on a typical Lyme person where you pick up on some unique characteristics that move the needle for them?
Not as much, because I actually haven't probably run the test on many of my Lyme patients, but more of my mycotoxin patients, and they seem to always have something in the glutathione pathway.
Oh, interesting.
And yeah, in the glutathione genes.
Which would make sense, because I think of mold and mycotoxins and mycotoxin exposures like an environmental chemical.
Yep.
And so they can't process those things out as a chemical. I realize Lyme is really kind of a unique thing, and maybe many of those other co-infections are as well as an infectious entity, right? But I would venture to say, Beth, that I wonder, and I don't have any proof of this, but if you think about the autistic kids, right, who seem to be leaning genetically more towards pro-inflammatory cytokines, right? It needs a trigger. I'm assuming that same type of pattern may exist in some of these people who are dealing with Lyme or the co-infections of Lyme, or maybe even the other chronic infections, where it's a chronic infection that's driving this inflammatory response. I bet you if you were able to look across the field or across this whole population of people, that they may lean in that direction from a pro-inflammatory standpoint as well. Do you know?
I mean, I totally agree with you, but again, I haven't really run the test on as many patients with Lyme, but I know Intelligent DNA is also working on a Lyme pathway. So there are now SNPs that are associated with, I guess, post-treatment Lyme syndrome. Don't quote me on that, but there are now genes associated with that, I believe. And so that panel I still think is being worked on. So that's going to be really interesting to see. And that would give me more, it would be more convincing. I'd be able to convince my patients more probably to run the panel when that comes out.
Well, some of this too, and the limitations in running some of these tests, is just the lack of education and awareness that's out in the general community.
Absolutely.
So it always takes some prep work and some knowledge, and it takes parents like yourself. And you go back to the early days with yourself, with Luke, right? You weren't getting help from your pediatrician. You weren't getting help. They were probably most likely, I don't want to make assumptions, but I'm assuming there wasn't much offered up as far as diet or supplements or gut function. I mean, I've been around 25 plus years. I know the drill with this, because I've talked to people all over the world, and it's the same theme. It's like, your child has autism. There's nothing you can do. So you do some ABA therapy, some speech therapy, and hope for the best. And we clearly know that isn't true. And it makes me wonder, I know we're a little bit off topic, but I'm thinking now from a genomic standpoint, if we're having this kind of reaction, this pro-inflammatory reaction with many of the kids on the spectrum, there is some trigger or triggers, and it's been my experience that many of them are triggered by immunological or heightened immunological reactivity to vaccines. Okay, so MMR is a big one. We know that fungal issues, bacterial issues, and toxins can also be a trigger and exacerbating factor for many. I'm not saying all. And so it makes me wonder then, in the current times that we are with COVID and post-long COVID issues and people who've had long vax issues now, if you were to look at things from a genomic standpoint, it wouldn't surprise me that same underlying pattern exists.
Yes, agreed.
So one question I want to ask you, and I'm going to take this back now to the autism world, and let's just layer in, and it's okay if you don't know, but I've often, one of myself and somebody like yourself who works with Lyme and works with PANDAS, for example, and it doesn't even have to be autism. We can just say children versus adults, okay? Do you tend to see Lyme, for example, tend to manifest differently in a child compared to an adult, from a general standpoint, where they tend to kind of manifest with similar complaints?
I actually think it's totally different. And I with the exception of acute Lyme, like an acute tick bite, and they might have an EM rash, a joint pain, and a fever. So other than that, but in the more chronic picture, the kids, I see high anxiety, bilateral knee pain, and stomach aches. Now, Tom Moorcroft, I'm sure you know Dr. Moorcroft, he always says, again, this might be my pocket of the world. The presentations that we see may be different. It's different regionally. But I see the kids, the adults, and we're talking about Lyme Borrelia, right? Not necessarily any of the co-infections, but
right.
So that's what I see with the kids. The adults in the more chronic picture, they tend to have much more neurological issues, and I see a lot of shooting neck, jaw pain, and migraines, occipital neuralgia, Bell's palsy, obviously crippling fatigue as well. But the kids, I see a lot of just high anxiety and stomach aches. It's very interesting.
What about mold mycotoxins? What's your assessment of that?
The overlap that I see with kids and adults is just chronic sinusitis. Where it differs, the kids tend to have weird. I see a fair amount of kids with weird hormonal dysregulation. Girls with really high levels of testosterone without PCOS. Or boys with really low levels of testosterone. They come in for fatigue and they have very, very low levels of testosterone. So I see weird hormonal dysregulation. And I'm talking specifically about adolescents because that's who I would test those things on.
Right.
And adults, I see a lot of they're getting sick all the time. They cannot regulate. They're picking up every cold, every virus. They also have a lot of brain fog. So even in long COVID, I'm like, is it mold or is it long COVID?
Right.
Because a lot of the long COVID patients come with those complaints, and I'm like, maybe you just have mold. Maybe you just spent, and Dr. Andrew Campbell, he's like, maybe they just spent a little too much time in their mold-infested home in the pandemic.
On lockdown,
yeah. In lockdown, exactly.
When we layer in autism on top of this, it becomes more challenging, right? Because the vast majority of these kids don't have language. So they can't really express themselves, or they can't talk. And so they have a lot of behavioral issues that manifest because of that. And trying to decipher a behavior based on mold and a behavior based on a food, or it could be extremely challenging. And my experience is similar to yours is that I see kids often exhibit different kinds of symptoms than adults. For example, I can't say that I see a lot of children exhibit the serious brain fog that you have adults explain.
Agreed.
Now, maybe some of the autistic kids are having that, but they can't express it. They can't talk. They can't say how they feel. So I've often recognized that with many adults, whether they have reactions to foods, or they've had exposures to environmental chemicals, or they have a lot of candida, they have a lot of things like that. They might have similar issues, brain fog, and sometimes hyperactivity, where they're just more anxious, but it's not the classical autism presentation. But we can think of it in many regards as sort of the same insults environmentally are happening in both groups. It's just that adults tend to manifest in a different way, and from an autism standpoint, the little kids tend to manifest things in more of an autistic way. And it probably has to do with neurodevelopment, patterning in the brain, and all of those types of things. So it's pretty interesting. One of the things about the mycotoxins is ochre toxin, for example. So there's actually been some studies that show that it interferes with dopamine metabolism. So it actually interferes with a hydroxylase enzyme that converts phenylalanine to tyrosine, and tyrosine to dopamine. So you can get dopamine dysregulation with some of these mycotoxins. So pretty interesting. That would make sense too, as you mentioned, just from an allergic reactivity standpoint, probably from a respiratory standpoint, because they're being driven into allergy because of the mold spores.
Yeah.
So can you maybe, and you kind of have a little bit, but I just want to ask you again, discuss maybe a patient case from your practice, if we take it back to the genomic testing, that I know you talked about Luke. I mean, you talked about, your colleague who also has picked up on things uniquely. Is there another kind of standout case that you can think about from an autism standpoint where the genetic testing was like, wow, this was really important? I realize it's important for everybody, but
yeah. So that bumetanide case was an older kid with autism. So that the low GABA signaling, that made a big difference for him. And then I had another kid in his 20s. I guess I call them kids still, but they're in their 20s, so they're adults. But I don't know, I can't help it. When we ran his panel, he had a lot of SNPs on. There's an autism contributing factors pathway, and the kid had 2 on almost every single one. But most of them were, again, like we talked about, like oxidative stress. So he had 2 copies of the SOD1 gene. And he also had 2 copies of the GLRX. So I think that's pronounced glutarodoxin, but again, leads to increased oxidative stress. So I was like, okay, here's this kid's theme. Let's just work on that a little bit. And we did things like added hydrogen water. I added in PQQ, CoQ10, chlorella with the chlorella bites. And that kid, really expressed, he had some language, and he was able to, even though he's on the spectrum, and he was able to tell me that he had an overall increased well-being, much better focus, much better ability to relate, much better energy. So, and that was just us trying to work on a little bit of these oxidative stress genes.
Interesting. So the superoxide dismutase, which is the SOD, that plays a big role, obviously, from an antioxidant system. And I'm curious, in your testing, when you think of just like the genomic testing, for example, in the autism world, what percentage of the kids would you say tend to have pretty strong genetic variant issues in mitochondrial function?
That's probably, I would say I'd see it in a 70 to 80% of the tests that I run.
That's what I was thinking. And that's a big area of research for me. I think it's really important. One last question on the patient standpoint. Have you worked at all in your practice with kids, adults, teenagers, whatever, who are not autistic, but have some type of underlying mitochondrial disorder that has either been documented or suspected to be there through genetic testing, where maybe you've come in with a genomic testing and found out some unique factors for them? Have you been presented with that scenario in practice?
Not that I can think of off the top of my head.
Okay.
So.
Because I think that is a really important thing when we think about the genetic testing that's looking for genetics of disease, and genomic testing that is looking for patterns of dysfunction, where those who have been given, let's just take, for example, somebody who's been given a diagnosis of a mitochondrial disorder, which is a mitochondrial disease, right? Often those parents or that individual are left somewhat hopeless with that. Well, there's really not much you can do. But if we expand it out and we start to think, well, what about the genomic testing? Perhaps there's other things that can be discovered that may not necessarily, quote unquote, fix the genetic disease part, but optimize function. Because ultimately, that's the way I view genomic testing, is it gives us insight into information that is another avenue to help optimize function. Would you agree?
I absolutely agree with that. Yes.
Which is why the testing is so important in autism, special needs individuals, but everybody else, honestly. it's to be able to find those unique little pieces of information that could be quite significant for somebody. And as you mentioned, the Intellect's system or approach, it's a living, breathing thing, right? It means they're constantly researching and adding new information. It's not static. It's constantly evolving because of the team of people that they have.
Yes, it really is like true, precision medicine. And has, I started with it early in my practice. So I kind of don't know any other way at this point.
Right.
Like I used it so early.
No, that's great. Well, Beth, as we finish up, any action steps that or words of wisdom or advice that you can give, family members or individuals out there who are, trying to improve their health and wellness, things that you've experienced yourself, or just in practice?
I think what's changed, at least in the last 16 years since my son's been small. So, kids with autism are such a good lesson about like health and the state of the environment. But I really think now we're up against one of the things that I'm doing the most, I feel like, is trying to detox some of these chemicals. Like glyphosate is in everything. Gosh, we have so many different chemicals now approved in the country. So I'm using that also foundationally. So if I have any words of wisdom, I would say, make sure, you like really take that clean home seriously now, because we're under a lot of assault in a lot of places that we weren't before. So, mycotoxins are a bigger problem now that your detox system is also dealing with things like glyphosate and chemicals. So eat as organic as possible. I think gluten really should be eliminated mostly from everybody's diet because of glyphosate. I use a lot of, I use binders pretty regularly now in a lot of people, just to bring down some of the toxic load. I don't know if you agree, Dr. Woeller, but I think we're up against a lot, and I have to really bring this to people's attention more than ever, that, the first step really not, diet, yes, whole food diet, but also reducing chemical exposure is super important in my opinion.
Yeah,
because of the assault.
Yeah, no, so. It's really a problem, and you're absolutely right. It's a comprehensive approach, right? It's a lifestyle approach, and these are things that fundamentally have to be implemented over time. It doesn't all have to happen in a weekend. Or usually doesn't, right. Because but it's making a conscious choice and a shift to move in those directions. And I often say it's not just for the autistic child; it's going to benefit the whole family.
Yes.
So So, Beth, it's been wonderful, and I appreciate your insight, your wisdom, your experience. How can people find you? Do you have any resources?
Yeah, I practice in Northern Virginia, so right outside of the DC Metro in Vienna, Virginia, at a practice called Pappas Health. I see patients, usually kind of cut off right now is about 6 years old and up to adulthood. And I work at with a doctor named Sam Pappas, so the name of the practice is called Pappas Health, and you can find me at pappashealth.com.
Excellent.
But I'm licensed right now in Maryland and Virginia only.
Terrific.
Working on the rest.
Well,
thank you for everything, Dr. Woeller.
Yeah, it's been my pleasure. Keep up the great work, and thanks again for joining me.
Thank you so much.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Woeller. For more information about this podcast, go to functionalmedicinedoctalk.com.